Good evening and welcome to tonight's webinar on My Health Record registration for medical specialists. We thank you for taking some time out of your evening to join us tonight. My name is Sonia Zara and I am from the Northwestern Melbourne Primary Health Network, together with my colleague Angela Heathcote from Eastern Melbourne Primary Health Network. We welcome our guest speaker tonight, Callista Hudson from the Australian Digital Health Agency. I would like to start this evening by acknowledging the traditional custodians and the Wurundjeri people of the Kulin Nation, whose unceded lands I am working on today. In the spirit of reconciliation, we acknowledge the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Tonight is the second of a two-part series of My Health Record registration webinars. This session provides a step-by-step process on My Health Record registration for medical specialists. The recording of our first two-part series on implementing a My Health Record policy in your organisation will be emailed to you after this session, just in case you missed it. Before we begin tonight, just to let you know that you are all on mute. You can at any time ask questions by typing them in the chat box. For those questions not covered in the presentation, our guest speaker will be more than happy to answer these at the end of the presentation. Tonight's webinar is being recorded and all attendees will receive an email with a copy of this recording, the presentation and any relevant resources. At the end of tonight's webinar, you will receive a short survey. We would be grateful if you could please take a couple of minutes to answer the questions. I would like to introduce our speaker, Callista Hudson from the Australian Digital Health Agency. Over to you, Callista. Thank you.
Thank you. Thanks very much, Sonia, for the acknowledgement of country and introduction. So welcome, everyone. This evening's presentation will cover digital health foundations, including PRODA, HPOS, and the Healthcare Identifier Service, My Health Record registration options for medical specialists, and the registration steps for specialist practices. I will also explain where to find further resources, training and support, and also where to get support for any step of the registration process. Let's start with compliance requirements. All healthcare providers in Australia have a professional and legal obligation to protect their patients' health information, and healthcare organisations that participate in the My Health Record system are required to comply with a range of obligations, including, before registering, developing a My Health Record security and access policy, define who will be assigned to roles that can act on behalf of the organisation and perform administrative functions relating to your participation, which are the responsible officer and organisation maintenance officer roles. Following registration, enable My Health Record in your software or set up access via the National Provider Portal. Ensure staff members have the appropriate user account access. Ensure staff have received training on how to use the system accurately and responsibly, and also communicate the policy to staff members. And there are also ongoing participation obligations, which include regular review of the policy, ongoing staff training, and user account management, for example. Before you get started, it is important to note that registering is a multi-step process and usually cannot be completed in one day. Often practices are very busy and this time needs to be booked in advance. The process usually follows the pattern displayed on screen, which includes, if the RO already has a PRODA account, a 30-minute process to register the organisation. Usually the application is approved within 24 hours, but can take up to 2 weeks. A 15-minute process to request a NASH certificate if required and link the OMO, and a 10-minute process to download the NASH or link CSP number or link identifiers if registering to use the National Provider Portal. Now, you might notice terms or acronyms that are new or unfamiliar, such as RO and OMO, or PRODA accounts, NASH certificates. These terms will all be explained in the upcoming slides. And as a reminder, a copy of this webinar recording and a copy of the presentation slides will be provided to you after tonight's event, and you can refer back to these at any time. Prior to registering to participate in the My Health Record system, organisations have a legislative requirement to prepare a My Health Record security and access policy. The agency or Office of the Australian Information Commissioner may ask healthcare providers to supply a copy of a current or previous version of their policy. This slide provides My Health Record policy information and links to policy templates that you can access, or alternatively, you can create your own. The PHNs will also send out a link to the previous webinar recording from this series, which covers implementing a My Health Record policy in your organisation in more detail. The My Health Record system requires people working in an organisation to be assigned roles which recognise the different responsibilities involved from administration through to healthcare provision. The responsible officer, or RO, is the person who has authority to act on behalf of the healthcare organisation and ensures the organisation and its employees' compliance with My Health Record participation requirements. In the case of a specialist practice, the specialist might also be the business owner and be assigned the RO role, and they would be the person who would complete the My Health Record registration. The Organisation Maintenance Officer, or OMO role, is a role that is responsible for the day-to-day administration of the HI service and the My Health Record system, and can be assigned, for example, to a practice manager. The OMO can complete day-to-day activities such as development and distribution of the My Health Record policy, staff training, and managing user accounts, for example. For digital health foundations, the Healthcare Identifiers, or HI service, is a national system for uniquely identifying healthcare providers, healthcare organisations, and individuals receiving healthcare. The HI service is a foundation component of all national digital health products and services, including My Health Record. The Individual Healthcare Identifier, or IHI, identifies a patient or individual receiving healthcare. The IHI is stored in the patient profile, and there are details required for IHI validation, which include patient demographics of first name, surname, gender, date of birth, and Medicare or DVA number. The Healthcare Provider Identifier Individual, or HPII, identifies an individual healthcare provider who provides healthcare, such as specialists, nurses, general practitioners, and pharmacists, for example. All staff who are AHPRA registered healthcare providers will already have had a HPI assigned to them, which will also need to be configured in your clinical software or in HPOS if using the National Provider Portal. Those staff can locate their HPII by logging into their AHPRA or phoning them to check, or by phoning the HI service, or if you know your AHPRA user ID, add the numbers 800361 to the front of the ID to get your HPII. The Healthcare Provider Identifier Organisation, or HPIO, identifies the healthcare provider organisation where healthcare is provided, such as medical practices, hospitals, and pharmacies, for example. When you register in the Healthcare Identifier service, your organisation will be assigned a HPIO, which will need to be configured in your clinical software or linked in HPOS if accessing the National Provider Portal. Healthcare identifiers help ensure individuals and healthcare providers have confidence that the right information is associated with the right individual at a particular point of care. Healthcare providers, such as specialists who are authorised to access My Health Record on behalf of their organisation, can access My Health Record through conformant clinical software to view and upload. Or if your healthcare provider organisation does not have access to conformant clinical software, you can use the read-only National Provider Portal to access My Health Record. As the National Provider Portal is a view-only portal, in order to upload information such as a specialist letter to the My Health Record, specialist practices would need to be using conformant clinical software. Tonight's presentation includes information for registering to access My Health Record via both of these options. And on the screen here, you can see examples of what specialists might see, whether accessing a patient's My Health Record via conformance software on the left, or by accessing via the National Provider Portal, or NPP as it's often called, on the right. On this slide, we have some My Health Record enabled practice software that specialists might be using, as well as what is in development. If your specialist practice is using a software that is not listed here, such as Medical Director, Best Practice, Communicare, or MMEX, for example, these softwares are also conformant with the My Health Record system. They are not listed here because they are software that is more commonly used by GPs. Let's look at the overview of the steps required to register a healthcare organisation for My Health Record. The responsible officer, or RO, who again might be the specialist, needs to create and log into their PRODA account, enter Health Professional Online Services, or HPOS, and register the seed organisation in the HI service and the My Health Record system. During the registration process, the RO can add additional OMOs, such as their practice manager, for example. Once the application has been approved, the OMO can then undertake the remaining tasks required, which will be different depending on whether the specialist practice is accessing My Health Record via conformance software or via the National Provider Portal. If your specialist practice is going to access the My Health Record system using conformance software, you may need to request and download what's called a National Authentication Service for Health Public Key Infrastructure Certificate, also known as a NASH certificate or a NASH PKI certificate. A NASH certificate is a digital certificate that authenticates an organisation whenever they access the My Health Record system using conformance software. Depending on your clinical software, however, you may not require a NASH certificate, and instead you may need to link your software provider's contracted service provider, or CSP number instead. Contracted service providers provide IT services or health information management services relating to the My Health Record system to healthcare provider organisations and interact with the My Health Record system on their behalf. Now, we do encourage you to reach out to your software provider for information and support early in your My Health Record registration process, as this will inform whether you need a NASH certificate or whether you need to link to your clinical software provider's CSP number. For example, if you are using MMEX, Genie via CSP, Gen2 or Clinic to Cloud, for example, practices won't need to request a NASH PKI certificate, and instead they would proceed to the linking CSP number steps. Again, we do encourage that you check with your software provider first to confirm. If your healthcare provider organisation does not have access to conformant clinical software, the steps are also different for accessing the National Provider Portal. To use the National Provider Portal, the specialist must have a PRODA account and their HPII must be linked to their organisation's HPIO in HPOS. Now, looking at this slide here, this may seem like a lengthy or complicated process. However, in this presentation, we have broken down each of the steps into more detail. On this slide, we have direct links to step-by-step instructions for registering for My Health Record and accessing via conformance software using either the NASH or Contracted Service Provider CSP approach, or if registering and accessing My Health Record via the National Provider Portal. So these are additional resources to assist you during your registration process. Okay, let's explain in more detail the process of registering for a PRODA account and linking this to HPOS. On our progress overview, we can see this is the first step in the process. So what is PRODA? PRODA is an online two-factor authentication system used to securely access government online services. It is the professional equivalent of the MyGov website, the secure platform which enables access to other services. Now, a verified PRODA account doesn't expire, and if you change your employer, you keep the same PRODA account because it belongs to you as an individual. Anyone who works in healthcare services, including health professionals and administration staff, can register for a PRODA account. Step 1, register for PRODA. To access services using PRODA, you need to register as an individual to get your own account. You can only register one PRODA account in your name, and you can only create a PRODA account online. First, create your account, then verify your identity, and finally, link your services. Now, some tips for when registering for your PRODA account. The RO and the OMO will each need to have their own individual PRODA account. Keep your PRODA account secure. Never share your details with anyone. Use your own personal and contact information to set up your account, as this is needed to verify your identity. So don't use your practice email address, as this is your PRODA account. Use your personal email address. You will be required to enter a verification code each time you log into PRODA, and the unique verification code is sent to you using your preferred method selected. It can be sent via SMS, email, or generated on the mobile app called the PRODA Code Generator. The app or the SMS options generally have quicker response times. PRODA will log out after 30 minutes of inactivity, and you need to comply with the PRODA terms and conditions when you register or use your PRODA account. The next step will involve linking your PRODA account to HPOS. What is HPOS? HPOS stands for Health Professional Online Services and is a fast and secure way for health professionals and administrators to do business with Services Australia. Follow this link for more information. To complete your registration process, you will need to establish your role in the health sector by linking your PRODA profile to your existing health services within existing health profiles within Human Services. The first time you log into PRODA, select the HPOS tile. Once you click on the HPOS tile, you will be prompted to link your identifiers to HPOS. So for the specialists, this could be, for example, linking your APRA number. You may have an identifier which may grant you more services within HPOS, but importantly for what we are discussing today, it will also expedite the My Health Record registration process by pre-populating information within the application. Administrators who don't have any identifiers held with Human Services are not required to complete this step and will continue to have access to administrative functions in HPOS only. After you have linked your PRODA to HPOS, you'll see the HPOS tile under the heading My Linked Services. And there is also a link here for further information about HPOS and linking health services. Next are the steps for registering your organisation for My Health Record using HPOS, which will need to be undertaken by the RO, Responsible Officer, who again might be the specialist. On the progress overview, this next step is where the RO will register the seed organisation. A seed organisation is a business entity that provides or controls the delivery of healthcare services. When you register a seed organisation in the HI service, the RO will also be assigned as the OMO. Only the RO can register a seed organisation because it's the primary organisation. You can also add additional OMOs when you're registering your organisation, such as your practice manager, for example. And once your registration has been approved, you will receive your organisation's HPIO number. Let's go through the steps now on the following slides. First, the RO would need to log into their PRODA account and enter their credentials. A unique verification code is then sent to their preferred contact platform, as was discussed previously. From the PRODA homepage, click on the Health Professional Online Services or HPOS tile, then the HPOS home screen will open. From here, select My Programs. Next, select the Healthcare Identifiers My Health Record tile, and then select the Healthcare Identifiers Register Seed Organisation tile. Once the next screen opens, you should read the important information before proceeding, then enter your ABN or ACN and click Apply Now. In the registration form, you would follow the prompts to enter the organisation details and the RO details. If the organisation requires multiple OMOs, this can be done as part of the registration process or at a later stage. Now, the Documents tab will appear if you are required to provide evidence of your authority to act on behalf of the organisation. This won't be required if your PRODA and Australian Business Register or ABR details match, unless there is a trust or a trading name. This is hard to know in advance, so we suggest to prepare the verifying document just in case. Once you have entered all the information, a confirmation screen will appear with a summary of the application for review. Use the back button to update the details if they're incorrect. You will also see the following acknowledgements, including attesting that a My Health Record security and access policy has been developed. When you are satisfied with the information, privacy notice and declarations, select I agree and then click Confirm. Once you have submitted your application, it may take 24 hours or more to be approved. Check your HPOS mailbox for notifications. In this next section, we have information for specialist practices needing to request and download a NASH certificate, information for practices needing to link their clinical software provider's CSP number, and information for practices needing to link the National Provider Portal. These are the final steps, and they are steps that can be undertaken by the OMO. So someone like your practice manager can undertake these activities if they have been assigned as the OMO. On the progress overview, once you have received confirmation that your application has been approved and you have received your HPIO number, organisations using a conformance software will need to complete either steps 3 or 5, depending on the software products in use. For specialists setting up access via the National Provider Portal, steps 3, 4 and 5 are on the right. For either of these access options, the section to go to in HPOS is actually the same. First, the RO or OMO can log on to PRODA and select the HPOS tile. Next, select My Programs, then select the Healthcare Identifiers and My Health Record tile. Select the My Health Record Manage Existing Records tile, then click on the business name and select My Organisation Details. This will open up to the Organisation Snapshot screen. If you are accessing My Health Record through your clinical software using a NASH certificate, click on the Certificates tab to request and download a NASH certificate. The Certificates tab is also where practices can link the Medicare PKI site certificate. If you are accessing My Health Record through your clinical software using a CSP link, click on the CSP Links tab. If you are accessing My Health Record via the National Provider Portal, click on the HPII Links tab. The RO or OMO needs to authorise healthcare providers' HPII numbers to use the My Health Record before the provider can access the National Provider Portal. Follow these steps to manage which clinicians in your organisation can access My Health Record. Steps to deactivate authorisation links are also specified. Now, these next 2 slides are additional steps for practices that require CSP linking or for National Provider Portal linking to My Health Record. They would need to click on the My Health Record Register Organisation tile, then select Manage Authorisation Links. And here is where you can manage HPII links and CSP authorisation links. Now, don't worry if you can't remember all of these steps, as you can go through these slides again at a later date or with your PHN. The benefits of specialists having access to key health information in their patient's My Health Record, such as pathology or diagnostic imaging reports, hospital discharge summaries, or medicines information, for example, can support specialists in their healthcare delivery. Also, if specialist practices are planning on using electronic prescribing later on, then these steps will assist you in that process. There is registration support available every step of the way. If you need help with the PRODA, HPOS, the HI service, or NASH certificates, for example, you can find the contact details here. And you can also contact the agency or contact your PHN for information and support as well. In terms of next steps, staff using My Health Record do need to be trained in My Health Record before using the system. On this slide, we have some options to assist with training, including online e-learning modules, such as Preparing for My Health Record and Introduction to My Health Record for Healthcare Providers. We have regular webinars that you can register for on our website or view on YouTube. We also have software summary sheets, simulators and demonstrations, and your software vendor may also have My Health Record manuals that you can access. If you would like any further information or support, we encourage you to visit either the My Health Record website or the Australian Digital Health Agency website, and we welcome you to contact us via email or via either of the helplines available on this slide. Now, thank you kindly for your attendance so far this evening, and I will pause here and hand over to Angela and Sonia to check if there are any questions.
Thanks so much, Calista. It's been a great session so far. I know there's lots and lots of steps involved, so I think this resource will be a valuable one for those people to go back and review. We do have one question that's come up, and the question was, can you save the application if you don't have all the supporting documents and need to come back to complete, or do you need to start again?
Good question, and I'm not entirely sure if it has a save function when you are in there, but they're reasonably sort of short steps. So sorry, I can't answer that question for you.
That's okay. So we might get you to give us that response so that we can include that as part of our follow-up resources to attendees. That'd be great. Another question, as a specialist, when I go to working in a hospital, how do I access the My Health Record? Is it through this process that I'm accessing, that I'm registering for now, or is there other ways of doing it through the hospital setting?
Sure, you may be able to access through, if that hospital is connected to My Health Record, you may be able to access through the hospital's information, clinical information system. But what you would need to do in that process as the specialist, you would need to contact the hospital's information manager for more information on how they use My Health Record in the hospital setting, and to see whether you would be able to gain access via their system.
Sure. And I think this one's relating to one of the previous slides that you had, all the contact details of support. There's one there. But obviously, if you do get stuck midway through your application, you don't know who to contact, there's lots of different contact details for PRODA, HBOS, all the different services. When you don't know which one to contact, which one should you go to? Is there an overall agency contact number to helpline? Is that 1300 one the best one to go to?
They can do, or they can contact you guys at the PHN if they're because you guys have these instructions as well. So if you are on the line and you are going through these steps, you're welcome to contact the PHN, either of your PHNs, for support.
That's right. And I think going back to your very first slide, Calista, you did mention that this process isn't going to be done in 2 hours. So people need to allow probably an hour or so over a few weeks process to actually allow for the different times to come back and do the different steps when needed. Fantastic. Look, I don't think there's any further questions unless you can see any more there, Sonia, but I think the most important thing to come out of tonight is that there's lots of resources available. There is another question. How long does it take to application to be processed? So once people have completed the application.
Sure. So in terms of once the application has been submitted, it could be approved anywhere from 24 hours up to two weeks perhaps.
Yeah, so depending on the stage of where they're up to. Fantastic. Yes. Thanks, Calista. I think what we'll do is we'll collate all these resources for everybody, including a copy of this recording and the copy of the slides, which most importantly has all these resources available. That along with a recording of the previous webinar, which was on how to implement a My Health Record policy in your organisation, which obviously needs to be done before you start your process of registration. We'll send that out as part of our resources today as well. I'd like to thank you, Callista, for your time this evening, and Sonia for also attending, and everybody else for attending online. If you can please take a moment to complete the survey when you finish off tonight, and in that survey you can actually put in details if you would like support from your local PHN to help you in your registration process. So I'd like to thank you all for your attendance tonight. I'll let you get back to your evening. So have a great evening, everybody, and we'll see you next time. Great. Thank you, everyone.
Great. Thanks, everyone.
Good night.
Thank you. Bye. Good night.
Bye.
Bye.